All right, if you're trying to heal some knee pain or back pain or any pain really, you want to start with the feet. So we're going to start off with toe crunches for 2 minutes. Just really squeezing like you're doing crunches with your foot. Then you want to get into these toe spreads. What I'm doing is I'm trying to reach out with my big toe away from the pinky toe as far as I can. Just spreading like you're spreading your fingers. You're going to spread your toes. This is helping get the arch activated again. Then you're going to go into piano toes. It's very important to give your toes its individuality, its own movement. So you're just lifting all the toes and then putting one down at a time and lifting up at one time or one at a time. So these are tib turns. So good for ankle stability, ankle strength, more explosion of when it comes to moving, like on a court, tennis court, basketball court. And all I'm doing is I'm touching pinky and then big toe. And go about 50 reps with those. So now we're getting to the outside of the leg. Lateral raises. Just go for 20 here. Then you're going to go for 10 bicycles. And then you're going to reverse that bicycle for another 10. Then you go kick your leg out, small circles going one way for 10, and then it's going to go the other way for 10 as well. Then you're going to go all the way forward, all the way back for 10. Just reaching as far as back, forward, and backwards. And then zigzag. So you're just going back and forth as you raise the foot, and you'll just be doing 5 reps of those. Now we're going to get into some bridges. I would do 15 reps each of these sets. So now I'm just on the outside of my foot, my pinky side of my foot, big toe side of the foot's off the floor. And I'm just pressing through that side of the foot and squeezing my glute at the top. After you hit 15 of those, you're going to go move to the big toe side. So then you're pressing through the big toe, trying to get the pinky off the floor. And still squeezing the glute at the top. It's very important to activate this full unit on the back of the leg. So 15 reps, both sides of the foot for each side of the leg. Next up is Patrick steps. Huge for ankle, opening up the ankle actively. Huge for building strength around the knee. So what I'm doing is I'm stepping out, touching my heel, keeping the full foot on the floor. You want to avoid the knee buckling in. Try to keep it going straight. And you're going to lean back, kind of pushing your hips forward, not putting any weight on the heel that's touching. It's just a light tap. And you're stepping out as far as you can and then lifting back up using a quad. Now we're going to work inside the leg. These are adductor lifts. So I'm just pressing through the inside of my foot, trying to use the whole inside of my leg to push myself up. If you're not here at this level, just leave the knee on the floor as you lift up. Now we're going to get to adductor squeezes, just getting more of the adductors inside of the legs more activated. It's going to help release a lot of pressure in the hips. So there's a slight hinge in here. I'm going to lean down just a little bit, hinging at my hips. And then I'm going to squeeze hard as I can the inside of my legs and my glutes as I come up and really press my pelvis forward. Squeezing the glutes. Now we're working into hip flexors. I have an anchor point at the bottom of my door, and I'm just have an attachment around my ankle, and I'm bringing the knee up, out, and around and back down, and then I'm bringing it back out and back up. Just kind of drawing a big circle with the knee. Then you'll flip over and you're doing frog raises. So you're just trying to bring your knee as closest to your elbow as you can, keeping the foot off the floor. This will really help activate the side and atop of the glute. Now we're getting into some abduction away from the midline. Same anchor point down low with the ankle attached. And I'm just bringing my leg out, trying to get outside the glute fired. And then we're going to go adduction, so across the midline. And really scoop that foot up as you come across. Really scoop the foot up. And bringing it back around to the hip flexors. I'm letting it pull me back, and I'm bringing my knee up as high as I can go. And if you see my other foot, I'm lifting up like I'm running. It's key to this movement. Now we're going into some standing split good morning. So I got a wide stance with my feet. I'm going to let the bands pull me forward. and I'm going to push my glutes back, and then I'm going to squeeze the floor of my feet, squeeze the inside of my legs and my glutes as I press and push my hips forward. Really make sure you're squeezing your legs as you pull back and lift up. And this is the opposite, the opposing movement. So you're pulling it from behind and really pressing forward as much as you can. Same thing, squeezing the legs in together, like in towards each other, and squeezing the floor and squeezing your glutes. Super important to squeeze as much as you can, getting everything activated. To tie this all together in an active sense, you're going to be on your forefeet, on your toes, tiptoe walking forward and backwards. You're going to try to lift up as high as you can. Then you'll turn your feet in and walk forward again. I know it might seem a little odd, but it's training a bunch of fascial pathways up from your foot into your hips. I know it might seem silly, but it's very beneficial. Then you're going to turn your feet out. Same thing, very engaged in the feet, lifting up high, being strong in the legs. Then you're going to be on the outsides of the foot. We're coming off the toes and you're on the outside of the feet. As far as you can go, even if it's just a little bit. Then we're going inward. I just start backwards, but you want to go forward and back with this one, with all of them. Sorry, a lot of traffic going on right here. Then you're going to stretch out the hip flexors. This is the end. Put something soft for your knee. Put your foot up on something. Pressing the knee down. When you lean forward, lunge forward, squeeze the glutes and lift up with your pelvis, like up towards the ceiling. You'll feel a major stretch in the quads.